So, as you said, my background, currently serve as Director of Healthcare Strategy and Technology for the Family and Social Service Administration for the state of Indiana. Prior to this, served as a statewide health IT director, specifically with the state HIE program and a not-for-profit called Indiana Health Information Technology. Prior background was VP of Operations of Provider Networks at Logansport Memorial Hospital. So have kind of worked on both sides of the fence as far as the healthcare side and the public sector side. And you know, the thing we're going to talk a little bit about tonight is consumer engagement and just kind of the consumer focus that healthcare is going through. And you know, some of the biggest challenges when you talk to healthcare providers is the consumer side and the BI side. So in some ways, the data and the consumer and how you bring this information together is some of the challenges that healthcare providers are having to face in the kind of changing dynamics that healthcare industry is currently going through. So going to talk a little bit about some of the activities that have been in kind of pilot projects that have been going on here in the state that were part of the state HIE program and some of the lessons learned and how that kind of applies to your industries and your companies as you are working with these different providers. And so the biggest change in the last couple of years in healthcare and why this has become such a big deal is the incentives that part of the high-tech funding that came as part of the era stimulus dollars has infused a significant amount of cash and capital within the industry. You know, billions of dollars. I think we're now in the $20 billion that has been invested in incentives for HIT solutions for hospital and providers for implementing electronic medical records, along with then all the payment changes. So you can see that at least at the federal government level, they are putting significant amount of money in the industry. And so that, along with then working to liberate data, has led to this kind of rocket fuel for innovation and potential within the market. So just to kind of underscore the numbers of what we've seen here in Indiana. So on the Medicare side, hospitals and eligible providers have received, you know, just shy of $350 million in HIT incentive funding over the last couple of years. Add in then the Medicaid side, another $170 million in Medicaid funding. So right there you can see just what, you know, this is going towards putting in electronic medical records, towards implementing BI solutions, patient portals, and this is just the start of some of these dollars. Now, while a lot of these dollars were kind of front-loaded to get providers started, there is still a continuing ratcheting up of the expectation on these electronic medical records. Then on top of that, you had the different payment reform models that are currently going on. Looking at getting away from the fee-for-service model and more into the population health model and paying for outcomes. And so just some of the examples of the different models that the insurance providers and Medicare and Medicaid are toying with, whether that be patient-centered medical homes, kind of at the provider side, accountable care organizations at both the hospital and provider level, bundled payments as far as not paying for every single item, but grouping the kind of episode of care into a single payment, and then starting to put penalties in place as far as you know, readmission reduction programs or not paying for, you know, events of poor outcomes that should not be expected within healthcare. So as you mix all these items together, whether, you know, the incentive side along with the different payment change, the different model changes, it's leading to providers and you know, healthcare providers looking for new solutions, new ways of doing business. So you're seeing a lot of these new technologies come online. You know, whether that be, you know, some of the, you know, the things that you're seeing now, what telehealth is starting to be out there, you know, e-visits and, you know, all these telestroke and telecardiology programs. Those are pieces that you're seeing today in the market. starting to see virtual visit concepts and mobile kind of clinical support starting to hit the market. You know, things we're going to start seeing shortly is mobile device integration and you know, medication adherence and basically tying new technology pieces into the healthcare model. And then where we're looking at in the future, I mean, you know, things, you know, tying in-car models and utilizing technology and, you know, that we're using in everyday life in new ways to be able to deliver better healthcare. So, as I mentioned, we've got the eye patient. Everyone is much more familiar. People are Googling. We've got the WebMD. We've got individuals utilizing these social media platforms. Patients are much more interested in researching and understanding their healthcare than what they ever have been before. You know, buying, you know, wearable devices. We just have not figured out yet how to fully integrate that within the industry. So a few years ago at the state HIE program and at the federal level, the Office of National Coordinator kicked off an initiative called the eHealth Initiative, looking for organizations and trying to drive this concept of placing the consumer at the center of healthcare. And so we were fortunate, Indiana was fortunate to be one of the 25 initial organizations at a kickoff meeting in Washington to stand up and say we believe and pledge to working towards helping the consumer have more access to their information. We've worked closely with a local personal health record called No More Clipboard, which is a Fort Wayne-based company that has been receiving national accolades for some of their work, and I'm going to talk a little bit about some of the pilot sites that we've done around the state. We received $3 million in supplemental funding to be able to work on some of these projects. And we also worked, another good example of trying to free up information. The state HIA program worked with the State Department of Health to launch MyVax Indiana, which is both a web portal along with a iPhone Android application to give consumers direct access to their immunization records that are stored at the State Department of Health. Also giving some real-time notification as far as how they match up to the schedule when the next immunizations are due. The big organizations around the state that were pledging to help to push this initiative forward of freeing up information, giving access to consumers, and many of these organizations have moved forward with that pledge. So the grant, as I mentioned, we received $3 million that was actually split out into two different projects, working to put the consumer at the center of care to free up clinical information and provide it in a personal health record. And so with that, around the state, we had 13 different pilot sites that of a variety of different outcomes and focuses, different types of groups from communities, a regional reference laboratory, hospitals, provider offices, so all different types of different organizations along with focuses to really kind of, because this really frankly is so new in this concept of giving individuals access to their information, kind of looking at what are the challenges of freeing up data, utilizing health information exchange to put information in the consumer's hand. And one of our kind of premier pilot sites was a rural community, a rural hospital in Batesville, Indiana, Margaret Mary Hospital. So at Margaret Mary, they have what we deemed as a portal nightmare. Every physician office, the hospital had a different portal or a different EMR solution. So from the consumer standpoint, in order to access information, you would have to go to 5, 6 different, depending on how many providers you were seeing, you potentially were going to have to go to different sites to be able to access this information. And so their concept was, how can we provide a single community portal through kind of a a untethered personal health record to be able to provide our consumers and our patients and their caregivers with a single source of access of information. And so overall, they have been very successful at rolling this out in their community. Some of the key pieces, and we'll talk a little bit later of some of the lessons learned, but they engaged their physicians and professionals in the community. They used their employees as some of the beta kind of testers, and and typically in most communities, the hospital is one of the biggest employers. You've got built-in consumers just with the employees and their dependents. So that was the initial rollout. But if you look at the uptake of getting 30 to 40% of the individuals in their community signed up with the portal and accessing their information in a very short time frame, nationally the goal is somewhere between 5 to 10% of people signing up. So this shows it is possible with the right marketing, with the right approach, to be able to get individuals to want to access their information. So there are significant challenges with any type of consumer engagement strategy. The first that I'll say is the policy side, and what to share, when to share it, looking at the data use agreements and what information can be shared legally, the patient identification and authentication and matching components, so ensuring that the right individuals are receiving information. In this case, especially at the Margaret Mary Hospital, they had potential. They were receiving data from 2 HIEs, one being out of the Cincinnati market, one being out of Indianapolis. They had patients that were, there was data that was flowing from Indiana, Ohio, and Kentucky. So you had 3 different minor consent policies across 3 different states. So looking at, in the case of a minor, how do you share with the information with the parents or the caregiver? You could also have that same issue at the elderly level. So there are a lot of policy issues that have to be worked through that do lead to some technical issues, although I'll say the technical issues are the easy piece. And same thing, in a lot of, you look at some of the other initiatives technology-wise, whether it be BI or any type of initiative. Technology is the piece you can typically come over. It's the policy piece that has to be addressed early on. So, looking at the technology and aligning it with, and adhering to, some of the national standards, significant workflow adjustments and integrating this within the overall workflow. Elapsed time, it takes way longer than what you expect to roll out these types of activities. And overall, this was innovation at the bleeding edge. There weren't a lot of examples of real good consumer engagement utilizing personal health records out in the industry. So some of the lessons learned, kind of the walk, run concept of looking at what is your long-term approach and how do you phase that in. Try not, it's one of those you see with a lot of projects. We want to do, everything all at once and be perfect at it versus trying to break it up into phases and bite it off in smaller chunks. And so really, from a healthcare provider, focusing on the things that were specific to meaningful use, things that were of greater value and higher impact. Some of those were releasing lab results to individuals, things that would get people hooked in wanting to use the product going forward. So policy before technology. As I mentioned before, you shouldn't underestimate the amount of time that it takes for that policy and kind of upfront planning. That there is a significant amount of selling that has to occur and getting all of the groups and stakeholders to understand what it is you're trying to accomplish and working towards basically selling the product. Understanding where the current workflow and how it fits within, it has to be fully integrated within the environment in which this can't be just some standalone solution that is separate from your overall workflow. Most of healthcare right now is still set up in a very paper world. And so conceptually, figuring out how do you integrate an electronic solution. Working on, kind of the provider expectations and both patient expectations. These are still evolving areas. As you mentioned, the academic and just the conceptual thought. Most providers were trained that you don't share this information. They are the sole source of information for healthcare. So, breaking it down as to, how to have an engaged patient, how to, not be afraid of sharing the full radiology report or the full, lab results and having that debate with a consumer. It's a very different model than what the healthcare model has been in the past. So the biggest thing is you should start now. Since it does take so long to implement these types of solutions, even if it's something that providers see on their roadmap down the road, there's no harm in starting that policy discussion today to get that initial piece out of the way so that when it comes to the point of the technology piece and the implementation, it will go much smoother versus trying to rush in a solution. And we say, my patient will never, patients are too old, too young, too poor, no access to the internet and to technology. All of this is false, and there are examples, many examples, across the country, and even within our pilots that showed that this technology and these use cases apply to everyone. And whether, we've got examples of, and frankly, some of our more successful are, some of the senior citizen population. It's some of the fastest growing groups to utilize some social media platforms and to interact with others. When you start getting the 50, 60, 70-year-old age, they are the ones adopting these solutions much faster than what people expect. In the one pilot site up in Fort Wayne at a cardiovascular clinic, we had examples of patients calling up that weren't even part of that provider clinic that had heard from someone that they had access to their information and wanted to know how they could access their information as well. So they were out telling their friends and now some of those individuals sign in the actual system every day to be able to, even though there was no new information, because they could. And so I think it just showcases that that there isn't a population that this doesn't apply to. That yes, there are certain groups that will be a bigger challenge than others, but we can overcome those challenges. Another example, not part of our pilot, but actually was at Howard University, where they gave smartphones to a homeless population to monitor diabetes and to input information as far as what they were eating and how they felt in an application. And as part of that, they got to keep the cell phone. They paid for a data plan of $30 a month for each of those individuals. They showcased for those individuals they were tracking, they were having $15,000 to $20,000 worth of annual cost by those individuals showing up in the ER, being admitted. That as part of the pilot, those same individuals were now only costing the healthcare system, I think the numbers were between $1,200 and $1,500 a year afterwards. So you can see by just a small investment in providing technology to people, you can have a significant decrease in the overall cost to the healthcare system. So, health information technology really is a foundation. It is something that can be built off of for all of these, the kind of changing models. And ultimately, we're kind of gearing towards, improved quality and efficiency and moving towards that population health. Basically, that triple aim that we all talk about in healthcare of improving overall outcomes, lowering costs, and overall efficiency within the healthcare environment. And so ultimately, some of the things that I think as kind of groups that we need to consider when we're implementing these strategies, the first, it's got to be included in the organizational strategy. This can't be something that's just the flavor of the month, or the top senior leadership has to be bought into the concept that consumer engagement is the right thing to do. When I go out and meet with hospitals and providers, especially talking about meaningful use in health information technology, it's clear very quickly you can understand, whether that organization is ultimately going to be successful in implementing health information technology. If the CEO and the CFO and those high executives understand what the process and are bought in and passionate about it, that is an organization that gets it and understands and is going to be successful moving forward. When they say, well, it's just an IT project that someone is working on, not really sure, those are the ones that frankly I worry about as far as understanding why it is we're implementing these solutions. Identify champions, identify those that are going to go out and evangelize and sell the solution to others. Know your patient populations. As mentioned, there are challenging populations. Know what it is, what's going to be the key drivers for them to want to utilize these solutions. Starting early, you're never going to be, you're never going to be at fault for starting earlier. The earlier, the better, because it does take a significant amount of time. Freeing the data. Don't be afraid of providing more information than what you think people need. And this is, we think, we don't know what they'll do with it. Put it out there. Get it out to individuals. Someone will find value in every piece of information. You'll be surprised at what some individuals find important. Integrate into the workflow. Make this part, it cannot stand separate from the overall infrastructure. You need to make the significant workflow enhancements and changes to make this a fully integrated piece. Employees are the best salespeople. So kind of along with, identifying the champions, employees and their, those that they care for and those, their friends, that is who you can sell. You've got a immediate group of individuals that can provide feedback if you're off base as well. Nothing's worse than rolling a solution out to market and it not hitting the mark. You'd much rather miss the mark with your employees than with the general market. So utilize your employees as the champions and as your testers, as your kind of guinea pigs for these initiatives as you roll out. Leverage national standards. This is a piece that you don't want to be building solutions that are kind of one-offs, that don't tie to others. Now, the hard part about this is the national standards are evolving, and HIT is still a very immature market. And so this is going to be a kind of a constant process of revamping the solutions to be able to meet those national standards. Mimic other industries. As I mentioned before, there are many other industries that have went through these types of revolutions before. Healthcare, I think healthcare, and I say academia still, are two of the industries that seem to be the most lacking in the overall use of technology and innovation to be able, and changing the model. Government may be right there shortly behind it in some cases, but whether it be the banking industry or the travel industry, the hotel and recreation industry. I mean, there's so many other industries that, they are things that we take for granted today that if you think back just 5-10 years ago, how different those industries, acted from a consumer standpoint, mimicking those industries and figuring out how do you implement those solutions within healthcare, I think is going to be advantageous. The organizations that figure out how to actively engage consumers are going to be the ones that will significantly differentiate themselves in the future and ultimately be overall successful. When you're talking about driving down cost, improving outcomes, frankly, very little can happen if the consumer is not fully engaged and the patient is not fully engaged in following through on taking care of themselves, having personal involvement, and following the directions of the healthcare providers.